Hello, thank you for joining this session presented as part of the workforce offerings for the annual 2024 ASCP meeting. My name is Susan Harrington, and I'm currently the chair of the Workforce Steering Committee, and I will be your moderator today as we present non-traditional recruitment methods for the next generation of laboratory professionals. We have three great speakers for you today. Lauren Scheffelbein is the Medical Laboratory Science Program Educational Coordinator at the University of Nebraska Medical Center. Jim Payne will be speaking as well. He's an instructor in the Medical Lab Assisting and Phlebotomy program at WMOCO Career and Technical Center. And then Kate Moreau will also speak. She's with the University of Vermont Medical Laboratory Sciences program. So I'll introduce each speaker as they begin their talk. So first, we have Lauren speaking. As I said, she's an educational coordinator at an MLS program. She worked as an MLS for 7 years before switching to the academic side. She's now focusing on teaching hands-on laboratory skills and recruiting the next generation of laboratory professionals. Her passion is combining art and science to build creative solutions, taking the lab out of the laboratory and into the classroom. Welcome, Lauren. We look forward to your talk.
Thank you so much for having me yet again. So again, my name is Lauren Scheffelbein, medical laboratory scientist here at the University of Nebraska Medical Center, serving as an education coordinator for our medical laboratory science program. I've been working in laboratory recruitment for 3 years now, continuously trying to develop new and engaging things to really bring the laboratory to its audience, especially high school students. So through surveys or conversations afterwards, I really try to hone in on what my audience is really looking for. What did they like? What brought them to my table and got them to ask questions? So really taking that input from them, this led me to the development of what I call lo-fi engagement. So today I would love to share with you some of these lo-fi beats that I have used to engage with high school students, things that have really worked for me and our program. Though first, I will disclose, I have no financial relationships with eligible companies to disclose here. And secondly, I should define what I mean when I say lo-fi laboratory engagement. So the term lo-fi is known best as a genre of music that has purposeful imperfections that make it sound lo-fi or low fidelity compared to the original source of music. Therefore, lo-fi laboratory engagement is then laboratory activities with purposeful abstractions compared to a true laboratory experience, which I would call hi-fi or high fidelity. So high fidelity is going to be that truest laboratory experience. It is hands-on, perhaps one of the best ways to learn, super realistic, and an excellent career exploration. It truly gives you what it feels like to work in a laboratory and helps to differentiate what we do in the laboratory in comparison to other healthcare professions, like what it feels to be a nurse or how it feels to be a doctor. There are some cons, however, and that is the distinct requirement for the biohazardous lab, or at the very least, a location approved for laboratory activities. That can be hard to come by. I am from Nebraska, so if I want to engage with a rural community, for example, I may be extremely limited in where I can bring Pseudomonas plates, right? Or where they approve of me lanceting fingers for blood typing. We are lucky enough to have a laboratory of our own here at UNMC, but it's a big ask to have high school students come drive to us. So it's a limiting factor for sure. Additionally, as you increase laboratory fidelity and you increase that activity's complexity, so now you're preparing specimens, you're making realistic, you have plates to check, things may not necessarily grow. You want those results to be what you're expecting. So with such limitations, hi-fi laboratory events tend to be sparse because with all that time and effort used to making them, you also tend to want to direct them at the audiences you feel are going to be the most likely to get something out of it and engage with it, such as pre-health or science clubs. So of course, UNMC has some UNMC has some hi-fi engagement events. Twice a year, we do hands-on case study events. We call them Shadow Saturday. I personally host this in our student laboratory. We are also entwined with a local high school program called High School Alliance, teaching an infectious disease course. So all the students come into the laboratory and do lots of microbiology. So as you can see, though, our hi-fi engagement is both sparse and targeted to its audience due to the intense time and effort. So we really had to think then, how do we want to reach more students, especially when we can't take that laboratory location with us? And this is where low fidelity or low-fi engagement really shines. But first, let's assuage some fears. So yes, it is not the real lab. We're not bringing the real experience to the high school students. But it doesn't mean that it's not representative or that it's drastically oversimplified. Instead, we need to think creatively and attempt to pull the foundations of what we do in the laboratory and place them in this non-biohazardous space. We need to create stand-ins, props, models, things that can be handled and explored with just a little more abstraction. In fact, I love this picture here of the student holding this molecule in her hand. She's in no way having a high fidelity experience with that molecule, but it is still something she can interact with, see the structure, how it moves and bends, and really let her explore that concept. So low fidelity activities are not limited by location because we are making them and they're props, we can pack them up. Again, in Nebraska, I have to think about how I can interact with some of my more rural communities, right? Well, with low fidelity props and engagement activities, I can pack it all up and drive 8 hours out of the town and come right back. I can host that same exact activity the exact same way here locally in Omaha. Easy to travel, easy to host. And so we end up reaching more audiences. We can attend more events. And because we are accepting a sort of lower fidelity to the laboratory experience, we can add a bit of a hook in the terms of a game or a challenge to really draw in more participants. Hopefully, high school students will bring their friends. So lo-fi engagement encourages question asking, exploration, and making an informed decision to seek out hi-fi engagement or additional information. I personally have had a student who did not know what medical laboratory science was until I happened to visit with a lo-fi engagement activity. They then attended our high fidelity Shadow Saturday event and then joined our MLS program. So it can certainly grab them. So what are some examples of lo-fi engagement and taking this lab out of the laboratory? I'm going to show you some of our success stories that can hopefully be inspiring for others to create their own sort of low fidelity laboratory activities. So booth-based events like career fairs are the perfect time to whip out a lo-fi activity. We don't need to just sit at a table with pamphlets. Get them to do something. So this picture here is from my booth at an event our College of Allied Health hosts, which is about 200 to 300 high school participants. It is an activity I call Meet Your Blood, since it's primarily hematology and blood banking, but this has been routinely pretty successful and is one of our go-tos for larger career fairs. So some things in this picture you may notice that high schoolers themselves have pointed out and said were very useful to them were the signs displaying the multiple branches of the career, different areas that might interest them. They loved the Meet Your Blood. They never thought about their own blood. I thought this one was kind of funny because it felt more personal to them. Now there's a strange tube and contraption and a ball pit I'll get to in a second. There's a digital slide for them to explore, and of course there was swag items available. So we had red blood cell stress balls for the high school students to come take after they had listened about medical laboratory science. So the core of this particular activity revolves around these balls you see here. And why, yes, they do look like pom-poms, bingo balls, and the leftovers of a toddler's ball pit. They are not those today, no. We have platelets, lysable red blood cells, and painted color-coded white blood cells that need to be differentiated due to our sick patient. The balls are then sorted into a contraption. It's made out of a clear piped tubes, so the balls fit in perfectly. And we use the sort of height of these tubes to dictate what normal is. So if a tube is drastically underfilled or overflowing, something is wrong with our patient and we need to investigate. So in our particular case here, our eosinophils are overflowing. They have to reference back to that Meet Your Blood worksheet and think, oh, our patient has a parasitic infection. Is it a little oversimplified? Yeah, it's not quite how it works, but it really illustrates the point of what a CBC is doing and what an MLS might be thinking through their results. From there, the students go to that digital slide where they're going to find it loaded with malaria. And we go, oh no, that malaria is lysing our patient's red blood cells. So next, they're going to go to our last little location where they are going to type patient red blood cells because they need a transfusion. So here you can see we've done blood typing with large chunk glitter and sealed Petri dishes. The students have to pick up the Petri dishes and rock them gently, just like ABO through slide method. Some of the glitter does have pre-made chunks that you cannot see when they are stationary. So they can interpret the agglutination inside and come to a conclusion about the patient's blood type. And from there, with some guidance and a chart, helps select some available units. Then they get their free little red blood cell. So again, is this high fidelity to laboratory work? Not exactly. It's a bit more complicated than this, but it looks weird and interesting, and it does the job of getting the high school students to stop by our booth. It gets them doing things with their hands, talking and asking questions, and it takes the abstract idea of what a laboratory does and makes it concrete. But what about smaller events? This is a huge table, right? What about more typical career fairs where it might just be one person at the table and you don't have a lot of room? Well, with all of these props, they don't go bad. So any one of these portions of this activity can be chopped down, and I use them again and again at various career fairs all by themselves, or sometimes even as conversation pieces. So another example of a low fidelity thing that I have used in career fairs is the desktop differential. I'm partial to hematology, so always doing hematology things. But I print high quality cell pictures and I cut them out and I spread them on my booth. And generally, when people approach my booth, I start with them about what medical laboratory scientists can do, but the conversation goes towards, would you like to try to corner a cancer cell? Now I have these mostly normals and I slide one blast in there. I have the normal cell visuals in my like Meet Your Blood, the same one that I used in that last activity. And I help them perform a very small differential. If they find the blast easily, I congratulate them. Good. Thanks for your efforts. This patient was able to receive treatment right away. Have you ever considered working in a lab as a hematologist? And if they find it difficult, that's still a very great conversation. It is difficult. I confirm that. And that's why the world needs trained professionals like medical laboratory scientists to help, find and treat cancer. So nobody likes cancer, and I've found that the high school students frequently want to see the face of it. They want to find that cancer cell and they want to talk about hematology, even if they weren't interested in medical laboratory science in my booth at all beforehand. So this activity is so easy to create, fast to perform at a booth, and while it's not a real right stain diff, it still gets the students thinking through the shapes of the cells and looking for malignancy, just like we would in the laboratory. My final one that I'll talk about today is sort of our most complicated and perhaps the most low fidelity that I have created, but it is wildly successful and a lot of fun and really gets the high school students talking. This is a laboratory puzzle room. I'm a lover of escape rooms, so of course I couldn't stop myself from making my own. There are pages worth of puzzle design and prep, but it is an excellent showstopper. The puzzle room activity is comprised of 4 separate lab areas: chemistry, hematology, microbiology, and blood bank, that'll have their own manuals, props, and puzzles. A lot of things, again, used from other activities that I've done and repurposed. So the patient has some history and symptoms and samples collected from him, such as swabs and urine and various tubes of blood. And students must read through that patient history and start exploring their labs in order to figure out what is going on with their patient. And each lab is deeply interlocked with the other. Some puzzles cannot be solved until your other friend across in the micro lab has solved their piece of the puzzle. Again, not high fidelity. The laboratory is not a puzzle room, but it does allow for the exploration of laboratory through puzzles. For example, those in the chemistry section will find they cannot run their patient sample on their machine. It is physically locked until they find a code. How do they open it? Well, by reading the analyzer's maintenance manual and performing maintenance and QC. By doing these actions in a certain correct order, numbers are revealed, allowing the machine to be ready for patient samples. The students have learned that laboratory analyzers require maintenance and QC. Other puzzle activities include lo-fi differential, because I love hemo, light-based chemical reactions using a small UV light, plating microspecimens in the right order, or correctly selecting blood products based on the patient's blood type. Those several lo-fi activities, including the balls that we saw earlier, students unravel this patient's final diagnosis. So they get a taste of the testing and actions that are performed in each of these special laboratories, along with a few key duties assigned to them. And then the pieces of the literal puzzle all fall into place, similarly to finding the diagnosis of a patient. So there are all kinds of creative little tiny ways that we can sort of lo-fi create things. That hematology analyzer I made was a wooden plank with PVC pipe and glue. We can recreate agar plates from melted soap and dye. I've heard melted crayons. The sky is the limit with creativity and a little bit of brain power and a little bit of engineering. We can really get the laboratory out of the lab and into classrooms and on top of desks. So, lo-fi activities are abstractions of real laboratory work. They're not going to be the right thing, but that's okay. And that's something that's fun to embrace and that high school students really enjoy. So these activities incorporate props or models to explain laboratory concepts to make up for that abstraction. They allow for more recruitment events to more diverse audiences due to their ability to completely pack up. They never age, and you can give the same experience in all over and over and over again. Their goal is to prompt exploration, further questions, and aid the decision to pursue additional experiences, such as continuing on into a hi-fi engagement activity. So those are my little lo-fi beats to use and engage with. Again, my name is Lauren Schieffelbein, and it was a pleasure to present here today.
Thank you, Lauren. That was terrific. I learned some new vocabulary, lo-fi and hi-fi, but I'm going to use it. I think it would be very appealing to young people, and I feel just so inspired by your enthusiasm, first of all, and by the creativity. And look forward to listening to this again and taking some ideas away from it. And I guess I would just say I have to agree with you. I think that our experience has been when presenting at career fairs that if you just have a table with papers on it, nobody's going to come by and they're just not going to get it. But having something with which students can interact really does pull them in. We've seen this at ASCA, and I know here where I work the same thing. So thank you so much for your presentation today. Our next state speaker is Jim Payne. He's currently the medical laboratory assisting and phlebotomy instructor at the Wamoko Career and Technical Education Center in Spencerport, New York. Prior to his current position, Jim worked at the University of Rochester as a research technician in the laboratory of Dr. Howard Federoff, studying biomarkers in the blood of Alzheimer's patients. And then he also worked in the lab of Elizabeth Grayhack, studying the genome of Streptococcus mutans. Over the course of 11 years, Jim has developed a top-level medical laboratory program for his juniors and seniors in high school. The program prepares students not only for direct employment in a medical laboratory, but also puts his students ahead of the game by teaching them college-level content. I've gotten to know Jim over the last couple of years. He's a very active member of the Workforce Steering Committee and has brought many great ideas to us. So look forward to hearing your talk today, Jim. Welcome.
Thank you, Dr. Harrington. I'm excited to speak to everyone today as part of the ASCP's 2024 annual meeting. As Dr. Harrington said, my name is Jim Payne, and I'm going to be speaking about high school phlebotomy and medical laboratory programs as a non-traditional recruitment method for the next generation of laboratory professionals. As stated by Lauren, I also have no financial relationships with ineligible companies to disclose. So in terms of learning objectives, I'm hoping by the end of our talk here today, you will have gained a understanding of the current workforce shortage crisis and have ability to explain why non-traditional methods might be needed for this situation to improve. Also, you will be able to explain how engaging with high school students, especially in a skills-based program, can increase the exposure of the field and therefore increase the number of students who go to college-based medical laboratory programs. I had Dr. Eric Pevsner of CDC once say about my skills-based program that we create the clinical and public health workforce of the future, and I hope by the end of this talk that you will agree with me. So let me give you some medical laboratory crisis statistics in terms of the employment crisis. Firstly, we do approximately 14 billion laboratory tests annually in the US, according to the CDC. To give you an idea of what 14 billion actually is, if you have 14 billion seconds, that is approximately 444 years. And we do that in terms of laboratory tests every single year. Additionally, we have some pretty scary staffing shortages. The shortages of greater than 25% in 16 states. We also are constantly growing. So the number of MLS and MLT is expected to increase by 11% by 2030. Most occupations, we're talking about only a 7% increase. To put that in some numbers that are easier to understand, we need almost 26,000 openings each year through 2030, and we only produce about 5,000 graduates a year. In terms of today's agenda, I'm hoping to talk about what I mean by the minor league of the medical laboratory. Hopefully you have a better understanding of what career and technical education is. You'll understand what a program like mine, that's a high school medical laboratory assistant and phlebotomy program, and what are some keys that I have found to be a successful program. So in terms of the minor league, if you think about baseball has the minor leagues and the majors. Most players initially go into the minor leagues. That allows them to develop skill sets, find out, is this a career for them, and hopefully grow to join the majors. My analogy with the medical laboratory world is to say that the minors are entry-level careers, your medical lab assistant and your phlebotomist. And your majors are anything that requires a college career. This actual diagram was created by the Workforce Steering Committee and specifically created or proposed by my subcommittee on improving the visibility of high school students as a way for people to see the potential pathways in the medical laboratory. And back to our analogy, if we were to fill up all of our minor league teams, the medical lab assistants and phlebotomists, we would have enough staff to obviously improve our laboratory conditions, but also some of those lab assistants or phlebotomists may show that they can handle moving up into the majors. and becoming medical lab technicians, histotechs, maybe even higher. And yeah, it may have been that just their high school situation didn't allow for them to be successful, but with a little bit of assistance from their laboratory, they can have the opportunity to move up and join the majors. And that's where our biggest need is. So hopefully by building a strong minor league of the lab, we can improve the majors. So what is career in tech ed? Traditionally, that was called vocational education. It was very much, you see me do the skill, then you do the skill. You see me do the skill, then you do the skill. Very little theory behind it, just enough so that you didn't get yourself hurt. Now with career and technical education, you're talking about a much deeper understanding, much higher level of theory that's required, and you're learning the math and the science and the how to write and speak appropriately in an English class as part of your career and tech education program. So you're far more well-rounded, far more prepared. If you wanted to move on to college, you could in comparison to vocational education. So I just want to do a little bragging because it's pretty cool that what my high school students get to use. So I'm going to talk about the fact that my students got their own research grade binocular microscopes with attached tablets, so they can take pictures and video of what they're looking at. They have UV vis spectrophotometers, so if they're doing DNA concentrations or doing optical density for microbiology, they have a tool for that. They just have a PCR thermocycler. They have a point of care clinical chemistry analyzer. They all have their own per bench set of micropetters, point of care urinalysis analyzer. They have a gel documentation system, whether we're doing PCR or restriction, digestion, and cloning. They actually can use the gel documentation system to take really good pictures of their gels and do all sorts of additional analysis using that. We have for our electrophoresis tanks, 6 gel electrophoresis tanks. So every student is able to run their own gel. We also have a refractometer for food science, but also for medical laboratory work. Our students are going to be drawing blood on real patients for real samples. So we have phlebotomy training arms that allow them to get the skill set down. So when they're actually out in the field on their training co-ops, they're extremely well prepared. We have microcentrifuges, clinical centrifuges. We even have a shaking incubator that has a magnetic connection, so we can add different attachments that will allow for various liquid media to be moved properly and allow for the bacterial growth. We're going to talk more in terms of the skills students are learning, but these are a whole bunch of the different plate tests. What we're talking about: mannitol salt, McConkey, EMB, even antibiotic susceptibility testing. They're doing capsule stains, endospore stains, gram stains. They're doing some biochemical tests, whether it's catalase or like the carbohydrate fermentation testing. They're getting a lot of different skills as part of it. We even teach some transferable skills that might be used in other areas, for example, titration, or they can actually make their own soap to teach them some basic organic chemistry. So now I'll give you some outline of the knowledge and skills that I'm teaching in the program. This is not a complete list, but this is something that will give us at least a starting point. So we teach them a lot of fundamentals, in terms of the theoretical knowledge. So they're going to understand any medical word they run into for the most part, because they're learning 1,000 prefixes and suffixes in medical terminology. Because we're in a high fidelity, thank you, Lauren, for a new term, high fidelity lab, not biohazardous, but pretty close. They're learning laboratory safety as close as we can make it for when they go out on co-op. They're also doing solution and dilution math, so that we actually make our own solutions. We do our own dilutions, so that in a way to save money, but also a good skill set to have. They're learning the phlebotomy theory they're going to need for national certification. They're also going to be learning some anatomy and physiology more at like a high school level. We're also teaching them college level knowledge. We want them to be prepared for college programs so they can move up to the majors easily. And so that's where we're teaching them hematology, immunology, microbiology, urinalysis, clin chem, histology, cytology, genetics, all things that they may use in a medical laboratory. and they can kind of explore different areas to see if they have a favorite. Some students absolutely love microbiology, some are more hematology, some like the histology. And getting a chance to experience that at a high enough level that they know they can do it is important. We get into our fundamental skills. So those are things like microscopy. My students are learning how to view it on pond water, bacteria, urine, urine sediment. They're also learning it even on blood samples. They're learning a lot of microscopy, so they're getting very, very good at it. Micropipetting, we're doing it all the time. And so when we move into something like PCR, which is really advanced micropipetting, they are extremely well prepared. Also things like titration or spectrophotometry. They're learning vein acupuncture, like I talked about, or making soap. In terms of their advanced skills, more of what's typically done at a majors level program. They're learning about how to do blood smears, how to do ELISAs, how to do all those variety of plate stains, biochemical tests I talked about earlier, how to do the chemical and microscopic analysis of urine, doing point of care clinical chemistry tests, learning bioinformatics where they're given just a sequence and then they have to determine what that gene does, where it's located, all those sorts of things. They're learning molecular cloning, PCR, bacterial transformation. And now that we just got a microtome recently, they're even going to be using a microtome to make tissue slides. I provide them with an employability profile. Basically, it's an entire set of skills that allows for students to be able to go to employer and say that I am independently qualified to work in these skill sets. If they're needing oversight, they're not really truly independent in their ability, that'll be on there too. If there's somebody that can apply it, like I said, with PCR being an applied micropipetting skill, they'll see a 4 in micropipetting. It's a way for employers to know how skilled our students are. One of the key parts of any high school laboratory program is the work-based learning. We want them going out into the laboratory and getting a chance to experience that. That can be through things like shadowing, unpaid training co-ops, or even paid co-ops where you're an employee and while you're learning. In the shadowing, you usually talk about 2 to 8 hours where they're working with somebody in the laboratory, watching them do the skill sets that they do. So for example, we do a PA shadow, pathologist assistant shadow, where our students are with pathologist assistants, with pathologists, with histotechs, getting a chance to see all those areas, and they can see if there's sights, sounds, or even smells. Histo tends to have some smells that they may not be okay with. If they're not, then they know that's not the career they want to. If it's something they do enjoy, then they may be even more determined to want to go into the career path. Our unpaid co-ops are usually training experiences where they're actually doing. So like my one student you can see on the slide here, she was drawing blood for 40 hours on real patients for real samples at one of our local labs. And she actually got 120 successful sticks in 40 hours. And it was an experience that was unpaid, but helped her really know this is what she wants to do. And she's currently working as a phlebotomist. You also have paid co-ops. So a couple of the paid co-ops that we do in my program, we happen to be near Eastman Kodak. So some of our students have done paid co-ops where they're working in the chemistry labs there. We've also had some of our students that are being paid to teach phlebotomy in their senior year as part of a paid training co-op. We got some awesome partners that provide various levels of work-based learning. The two I'm going to highlight right now, University of Rochester and Rochester Regional Health, are the ones that not only provide shadows, but also those unpaid training co-ops that have been vital for my program to be able to offer certification and have my students really fall in love with the laboratory. The goal is that our students are career and college ready. So one of the ways we make sure that they're career ready is national certification. So we are a phlebotomy medical lab assisting program. So when you think about phlebotomy certification, you want to think about what are the required number of successful sticks and if there are a required number of clinical hours. So for example, the board of certification does require 100 clinical hours. And so that makes it difficult for currently my program to offer that. I'm hoping that we can find a way to make that work in the future. When you're designing the content for the program, you want to look at the certification exams blueprint and see that all of the theoretical content you're planning on having in the program is in your program. You don't want to shortchange a student where something that's on the test is not in there. Same thing with the medical lab assistant certification, checking the blueprint and knowing what are the required number of hours so you can work with your local labs to have that happen. You also want to have college opportunities for students, and those can go through college articulation agreements, where it could be very minimal things like waiving application fees or having your application moved to the top of the pile, or having really awesome opportunities where students can waive certain classes or get dual credit as part of it. And several of our institutions you can see down here are actually offering thousands of dollars in scholarships for our students to attend their program. So I want to get into some keys to success. If you're going to create a program, first check what your CT standards are for your state. You may not have any for medical laboratory. In that case, you want to contact state ed as several laboratories in the area saying we want to form a program at a CT, Career and Technical Education Center locally, and we want to have that program created. It may be something where they don't have state standards. Maybe they want to look at New York State. We have pretty rigorous standards in New York State as a starting point and get the ball rolling with that. Once you have a program, get work-based learning done early. So if you're a laboratory, set up shadows, plan for training co-ops so that students can get in. That's what's really going to draw them in and will allow for certification. You want to go to laboratory visits students to see the real thing. No matter how good, how high fidelity your lab is, it's still not as good as seeing the real thing. And so getting those opportunities, also having tons of guest speakers come in, whether it's on Zoom or in person. If you can have an in-person guest speaker, have them bring something for the students to do. So like my students here were learning how to do H&E staining after the person had done a guest speaker on PA. You want to develop a challenging, engaging curriculum so that students are prepared for college programs and therefore can move up to the majors more easily than your average MLA or PBT. If you can afford it, this can take time to get there. Make sure there's enough equipment so sharing is minimized. Therefore, students get more time actually using the equipment and becoming truly skilled in it. You also want to ensure that school counselors are knowledgeable about the program so they can be advocates for your program out in the community and can truly explain what a laboratorian does. Our last two keys to success, making sure you have transferable skills that allow students to explore careers and also promoting your program. You can promote things like on LinkedIn, also trying to get out to meet industry professionals, making sure the whole industry in your area knows about your program and getting the news media involved. So for example, I'm holding a proclamation from our county executive to the right of me that was for Medical Lab Professionals Week, not last year, but the year before. And he wanted to get involved because the state legislature was giving us a formal proclamation and the county legislature, he wanted to make sure that he was part of it too. And so that's a great opportunity to promote your program. So hopefully at this point, you better understand the workforce shortage crisis and you see some ways that non-traditional methods might be needed to address the situation. Also, why a skills-based program like mine might help you increase the exposure of the field and therefore increase the number of students that go to college programs. I had some articles last year that you may want to read to get a better understanding. I'll also be having some articles in the critical values through ASCP. They'll be coming out in the next few months. And these are my works cited. Thank you for listening to my talk.
Thank you so much, Jim. That was terrific. Your passion for the profession and your commitment to these students is, I know no one like you. So just thank you so much. And I would just, point out to the audience that in one of Jim's early slides, he showed that career ladder, the career roadmap. We do have that now on the What's My Next web pages at ASCP, thanks to Jim's vision. And that is downloadable for folks to use in teaching about the laboratory profession. So thank you so much for all you do and for presenting here today.
Thank you very
Our-
much.
Yes, our third speaker is Kate Moreau. Kate's a clinical associate professor at the University of Vermont and is the program director for medical laboratory sciences. She also serves as the CLIA director for an FQHC in Burlington, Vermont, and she chairs the ASCLS, Patient Safety and Diagnostic Stewardship Committee. Her areas of interest are workforce development, community partnerships, point of care testing, patient safety, and population health. Welcome, Kate. We look forward to your talk.
Thank you, Dr. Harrington. Thank you also to ASCP and the organizers of this event for having me and giving me the opportunity to share with you a little bit about some of the somewhat non-traditional ways that we are trying to raise awareness of the laboratory science field within higher education. So first, I want to share that I have no financial relationships with ineligible companies to disclose. So I've set a few objectives for the presentation today. The first is that by the end of this talk, I would like participants to be able to identify and explain at least 2 methods through which students can learn about opportunities and careers in the laboratory sciences. Second, I would like them to be able to list at least 3 ways, but hopefully new ways, that students and program directors may communicate information about laboratory science programs and career opportunities. And then lastly, I would like you to be equipped with resources to take at least 1 action to raise awareness of the laboratory profession at your local college or university. So I've organized this talk with a series of challenges. I have 3 challenges, starting with obviously an awareness issue. So we all know that there is an awareness issue surrounding our profession. And I wanted to start with a little story. We moved to Vermont when I was in my early 30s. I had 2 young children at the time. I had a bachelor's of science. I had years of previous lab experience. However, I had never heard of medical laboratory science until I pursued a new job at the local hospital. Fortunately for me, there was a post-baccalaureate certificate program at the university right next door, which happened to be UVM, and that's where I am today. But I had not known about this profession until I started looking for a job, despite the fact that I had lab work done over the years. And so how can it be that over 100,000 students graduate each year with a bachelor's of science in biological or physical sciences, yet numerous laboratory science programs have seats that are left empty due to low enrollment? The previous speaker had shared with you some of the stats about the workforce shortage, so we know that we need to figure out ways to fill those seats. Some will argue that students who are looking to pursue a career in the health professions, it might be due to a salary difference, and I am not here to dispute or discuss anything about salary. It's more about an awareness, because I come from a place of patient safety. I feel very strongly about it, and I think those who really connect with the profession and have their why would likely do so as well if they knew about it. So let's see, where could students learn about laboratory science programs? I am not a social media expert, so let me start by saying that I have 3 teens who are 19, 17, and 13 who think very much the opposite is true, but they do spend a lot of time with social media. So I thought this was a little interesting. Digital marketing and communication experts are knowledgeable about who uses which social media platform most frequently. But if you're like me as a program director and have limited access to resources, come from a science background, not a marketing background, you might not have this access to this information. So there's a couple of graphs here. First, on the left, we see a graph, and it's illustrating the percent of US teens ages 13 to 17 who say they ever use the following apps or sites. So we can see that that in 2014-15, there were a few social media platforms that were surveyed. And then on the right-hand side of that graph, it goes up to 22, 23 with numerous additional platforms. And this can be very overwhelming when we're thinking of social media as a tool to promote, our programs or a profession, for example. But a lot of these didn't exist back then. But we can discern a couple of things from this. YouTube is overwhelmingly the most popular app. And if you look on the right, we will see a comparison. Similar year, 22, 23, for different age groups, for some older age groups. And I have some arrows here to point out that we have very similar carry through with social media for ages 18 to 29, which are our college age students. Snapchat continues to rise in popularity, bundled with the usage of TikTok and Instagram. I fall into an older category, so Facebook has been more my tool for social media. However, popularity of that dramatically decreases with these other age groups. So what's something that all of these groups have in common, or these apps have in common? And that's that they have videos and engaging content. Which is really important to think about. They're not long videos, but it's a lot of information. And if we think about careers and where people might be learning about jobs or what they might want to do, oftentimes they'll go to LinkedIn for those resources. And so thinking about ways to share information about your programs, this could be really useful information. So we don't want to, the aha moment that we have, or the takeaway, is to not underestimate the power of social media as a recruitment tool, as a non-traditional pathway for students to learn about fields or programs. So once students are actually on campus, so say they knew about the program, or maybe they didn't know about the program, how can we actually reach them if they're say they're in chemistry or biology? This slide highlights some ways that we can showcase ourselves. We're a fairly small program on our campus. We have an undergraduate program that has two concentrations, actually, in clinical lab science and in public health lab science. We have a post-bac certificate program, and we have a master's program, which is an entry level. But overall, our program is still very small. We're about 25 students on a campus with, I think, 13,000 students. So how can we raise awareness? And one way that we do that is by celebrating Lab Week each year. So on the left there, you can see that there's a couple of pictures of a table set up with some lo-fi activities. We have students who have made poster boards for us. We bring a game wheel, we bring a microscope with some slides that we've used Lab Week games to, engage people as they come up to the table. We've given away swag. Interestingly, the students in these photos, there's one faculty member in the lower left of that purple bubble there, but the other three are actually transfer students who have learned about the program once they've already been on campus. One of the more common things that we encounter is that students would come up to the table thinking about it's just for a job. We're celebrating Lab Week because we're celebrating medical laboratory professionals, but I really celebrate all laboratory professionals. And they're so surprised to learn that medical laboratory science is also a major on campus. So again, some awareness issues around that. Something else that we're looking to do, we have plans to host a blood drive that's sponsored by our program, and we're collaborating with our immunohematology class. So those students are not only engaging in what they're learning, but they're also promoting some service learning opportunity by being involved with putting on a blood drive, which again, there's a little bit of advertising there. If your campus happens to be like ours, we have to be very careful about not poaching students from other programs. So we can't really advertise the major as such. So we try to do it in a creative way so as not to offend others, but to raise awareness that students do have the opportunity to pursue a program as an undergrad in a field as exciting as this one. Another one of our previous speakers had mentioned summer internships and partnerships. Summer paid internships go a long way with our students. They're very interested in engaging with the laboratory and getting out there early. So something that's unique about these paid summer internships is that it's a partnership with our program and our students are prioritized. So although they're posted publicly on perhaps the medical center's website under their job postings, they're also posted on something called Handshake that I'll discuss in a minute. But when students are looking for internship opportunities, it's another way for them to see, oh, what do you mean? What is this additional training in medical laboratory science all about? What is this certificate that I need or this license that I need? And so creating those partnerships are really important. A lot of those students too will then go on to do a clinical rotation at that hospital and perhaps even become employed there after they've graduated. So I did mention Handshake. There's a QR code on this screen here if you're interested in learning more. Over 1,400 college campuses utilize Handshake, which is a tool to connect employers and organizations to students and alumni. It not only provides information about those opportunities, but you can also learn about upcoming career fairs or mock interview workshops or networking events. So if you are an employer or a different school and someone external to the university, you can post your opportunity here on Handshake to expose it to more and more of those college age students. It's just one way. There are other tools out there that career centers might use across campuses. For this one in particular, there's both free and premium versions depending on your needs and goals, but I'd encourage you to check it out. As a student, there is a way for them to set up an alert if something comes across their inbox or something is posted that they're interested in. So it's a really live system. The next challenge that I want to mention is retention. So once we actually have a student in the program, or we have hired someone, or maybe they're an intern, how do we actually keep them? What is a way that we can have them, stay in the field, perhaps like move through into a different career path within laboratory sciences? And one of the ways that I do that, I try to start early with the students and asking them, like, what is their why? So we have an assignment that I'm going to describe on the next slide, but I've included this blurb here, which is what I include at the top of the assignment. So if you're not familiar, the ASCLS has a pledge to the profession within the Code of Ethics, stating it is our duty to promote the advancement of the profession. And we do this by improving and disseminating the body of knowledge, adopting scientific advances that benefit the patient, maintaining high standards of practice and education, and seeking fair economic working conditions for members of the profession. And so I have added within the assignment that medical and public health laboratories are experiencing severe staffing shortages across the country. There have been fewer students entering these laboratory science programs, which means fewer graduates. And with increased workloads and fewer graduates, patient safety is at risk. And one way we can make an impact is to let more students know that this field exists. It simply can't be known as the hidden profession anymore. So we do that in a fun, I would call this a lo-fi activity because of the level of engagement with it. But I've titled it to be a ladvocate, and that is a term that I've adopted from the ASCLS. They have created this term in relation to policy and outreach. And what I've done is try to instill advocacy and outreach within the students in our program by inserting this outreach activity as an assignment in one of their capstone courses. So we start out by asking them to reflect. I first want them to think about how they learned about medical laboratory science and what do they wish they had known about earlier, whether it was in middle or high school or even early college years. So they think about that and we talk about it on the discussion board. Then I want them to think about the type of outreach activity that they would like to do. And this is within their comfort zone. Some do live presentations within classrooms. Some will record something, some will make a brochure that can be distributed, and some are digital. So we try to reach all different audiences in different ways. And then I ask them to think about who their audience is in contact. I want to know if they want to reach middle school, a high school, public library. It could be first year college students. It could be their dormitory. It could be anything. And the prompt is, what is medical laboratory science? And what we see here on the left are just some screenshots of examples of things that students have created in the past and their level of outreach. So one student one year made a POW tune. If you don't know what this is, it's basically a cartoon that you can create and tell a story. And she did it. It was about 7 minutes long, and it has been shared over and over and over and over again. Such a great tool and resource to utilize. And all of these are reused with permission from the student. We had CBU celebrations. CBU is actually a local regional high school. We had a post-bac student who was an alum of CBU, wrote to the principal, created a digital flyer, thanked his microbiology teacher from high school, and talked about what he's doing now. And this went out to over 1,200 students and their parents and the faculty at the school, because oftentimes teachers don't know or parents don't know what this program is either. Bottom was a webinar, a screenshot that someone did during COVID with her AT Chem class. And then you have a little shot of a brochure. So again, there's only one of me. There's so many people to reach and students to reach. And so a way to do that is to incorporate our students into these activities. And if you have 20, 25 students, multiply that by their audience, their location, the much greater geographic reach than I could do throughout the academic year. And lastly, we all know that there's a challenge with resources, whether it be time or money, or something else, or just personnel and availability. So I wanted to share some existing resources. It's a great segue from, again, what's already been said within this webinar. You don't have to reinvent the wheel. We're all super busy. And fortunately, there's a lot of existing resources that we can adopt and adapt, including the one that Jim had shared in his presentation, as well as a lot of other one-pagers, ambassador programs, information about how to create partnerships, whether you're a program, a university-based program, or a hospital-based program, or if one doesn't exist in your area. So I would encourage you at any level that you're at, from middle school through university and then beyond, to explore some of these resources, which are all linked here on this slide. And I'd like to leave you with some thought-provoking questions, hopefully, to think about maybe what you could do to take action to raise awareness about laboratory science. Think about how your institution or organization posts opportunities. Do they use something like Handshake in their career center? I'd encourage you to create an account to check it out, or even trying to post an opportunity. Are your students currently involved in any advocacy and outreach activities, or is that something that you could create with them? Is there a project incorporated into the program that provides an outside connection to laboratory services? And can you incorporate students from other programs into those classes? And then if you're someone from off campus, does your laboratory have a partnership with a local college or university? I know it within our medical center in the health network, we have a Department of Pathology and Laboratory Medicine that has an education committee that I serve on with them. So when they're going out to do some of these outreach type activities, they can call on our students to come with them if they need some volunteers. And if we need a speaker, I can call on them to come into our student center to do a presentation for it. Can your organization offer any paid internships? Is that possible? And by paid, even a small stipend makes a big difference for the students to help cover their living expenses for the summer. And then, do you include your local university or program in your outreach initiatives? If there's, depending on the size of your location, it's really great to partner with those, whether you're really rural or very urban, just to increase the reach that you have. So I want to thank you for your time and for the opportunity to speak with you. I've shared my email there if you have any additional questions. There are some resources here if you're interested in looking further into social media and what's used. These are where I had gotten the fact sheets from. That is all I have. I'd like to turn it back over to Dr. Harrington.
Thank you, Kate. You've given us a lot to think about from the perspective of the medical laboratory science program and interacting with students and hospitals and public health. So really appreciate the perspective you bring to this issue. I'd like to thank all of our speakers today, Lauren and Jim and Kate. We just really appreciate your talks today and also what you do for the profession every day. So thank you all for joining this conversation, and we'll look forward to seeing you at the annual meeting. Bye now.